All right, this video is going to talk about the Kirby Bauer test for determining cross-resistance. The Kirby Bauer test was actually developed in 1956 in order to test the efficacy of antibiotics because of the concern of resistance. It's funny how some things never change. The test is very similar to the Auger diffusion test that you're using to look at the rate of acquiring resistance, but there are some important differences that you should be aware of. On this plate, the researchers have set the test up to test 4 antibiotics at a time. Note that the antibiotics are on standardized discs that are coded with respect to what antibiotic the disc contains and the dose that it contains. A bacterial lawn is created on the plate with your bacteria of interest. In our experiment, we'll use the resistant bacteria that you've created through the Auger diffusion test. And you then place the filter paper discs down on top of it. You incubate that plate for 24 hours at 37 degrees Celsius and then come in to read the results. As with the Auger diffusion test, what you're going to do is measure the width of the zone of inhibition. But there are some important differences. The first important difference is that this is a snapshot. There are no rounds of selection in this. You just do it once, read the plate, and then you're done with it. The second thing is that you compare your observed width of the zone of inhibition to a standard. Standard widths have been developed depending on the auger and the antibiotic that's used, and you just compare the width of your zone of inhibition to that standard width. And then the third important difference is that the results are dichotomous. Either yes, the bacteria are resistant to that antibiotic, and thus the antibiotic will not be effective, or no, the bacteria are not resistant to that antibiotic, and that antibiotic will be effective. This test is actually used a great deal in hospitals in order to determine if a course of antibiotics is going to be working for a patient or not. So we will be doing this test to look for cross-resistance to antibiotics for our triclosan-resistant bacteria, and that's the Kirby Bauer test.